Welcome to the last in this series of video lessons on diet and lifestyle diseases as relevant to Stage 2 nutrition. Today's lesson will focus on diabetes type 2 and the glycemic index. There are two types of diabetes, type 1, which is genetically inherited, and type 2, which is considered a lifestyle disease and will be the focus of today's video. It is estimated that approximately 1.7 million Australians suffer from diabetes, and of these, 85% suffer from type 2. With a further 280 Australians being diagnosed each day, it leads us to the question of what's going wrong. To be able to answer this question, we first need to understand what normal blood glucose regulation looks like. The word homeostasis refers to the condition when blood glucose levels are approximately 90 milligrams per 100 millilitres of blood. This system can easily be put into imbalance. For example, on the right-hand side, we have a stimulus, which is declining blood glucose levels. This could occur because it's been a while since you've had something to eat, or because you've been involved in sustained exercise, or any other reason which would mean that blood glucose levels would drop below their normal levels. In this situation, in a normal, healthy person, the pancreas would be stimulated to secrete a hormone known as glucagon, and this stimulates glycogen breakdown. So, glucagon is able to send a message to the liver and the muscles to break down the glycogen, which has previously been stored, into glucose molecules that are able to return into the blood and return blood glucose levels to normal. On the other hand, on the left side of the screen, we have a stimulus, which is rising blood glucose levels. This could be the case, for example, if you've just eaten a big meal. When this occurs, the pancreas of a healthy person will secrete the hormone insulin, which will stimulate glycogen formation, which means that glucose in the blood is being converted into glycogen, which is then stored in the cells of the muscle or the liver. Additionally, glucose could be uptaken by cells which need the glucose for energy. As a result of these two pathways, blood glucose levels fall back to the normal range and homeostasis is restored. Remember, this is the situation for a normal, healthy, non-diabetic person. If we now look at someone who has type 2 diabetes, which is also referred to as diabetes mellitus, they have a reduced capacity for their cells to uptake glucose from a condition known as insulin resistance. Again, looking at the image on the right-hand side, in a normal healthy person, the pancreas, shown in the left of the diagram, produces the hormone insulin, which is recognized by an insulin receptor on the outside of a cell, which is then able to promote glucose uptake from the bloodstream. We'll ignore type 1 diabetes as it's not the focus of today's lesson. Looking at the bottom of the image, we see the condition for type 2 diabetes. Here, insulin is produced by the pancreas, mostly as normal. However, the insulin receptors on the outside of the cell do not recognize insulin or do not respond to it, and therefore glucose molecules are left circulating in the bloodstream and are not taken up efficiently by cells. As a result, blood glucose levels remain abnormally high. For reference, normal blood glucose levels are between 4 and approximately 8 millimoles per litre. The situation of insulin resistance develops over time, as the insulin produced by the pancreas becomes increasingly ineffective at managing blood glucose levels. As a result, the pancreas responds by producing greater and greater amounts of insulin to try and manage blood glucose levels. Over time, the cells in the pancreas actually wear themselves out trying to do this, so that by the time you are diagnosed with type 2 diabetes, it's likely that you would have lost between 50 to 70% of the cells responsible for producing insulin. So in type 2 diabetes, you'll have a combination of ineffective insulin and not enough insulin being produced, and the condition progresses and worsens over time. So, if you are suspicious that you may have diabetes, what type of symptoms would you have? A typical diabetic patient is always tired, is frequently feeling the need to urinate, often experiences sudden and unexplained weight loss or wounds that won't heal. They may well be always hungry, experience blurry vision, numb or tingling hands or feet, be always thirsty, and also be more at risk of various infections. Diabetics suffer from two different and opposite blood glucose level situations. The first one we'll talk about is hyperglycemia, where blood sugar levels are too high. To help you remember this, you can think of hyperactive as being a child who is far too active. So hyperglycemia has blood sugar levels that are too high. This can occur as a result of sickness, infection, stress, too much carbohydrate, not enough insulin or medical treatment, or some interaction with other tablets or medication. The typical symptoms that someone would experience when their blood sugar levels are too high include being extremely thirsty, needing to urinate often, having dry skin and mouth, feeling hungry, blurred vision, drowsy, slow healing wounds. On the other hand, if blood sugar levels drop too low, this is known as hypoglycemia. This may occur as a result of being physically active, not consuming enough carbohydrate, skipping meals, or actually having too much insulin. Symptoms include feeling shaky, having a rapid heartbeat, sweating, feeling dizzy, anxious, hungry, blurred vision again, feeling weakness or fatigue, or headache, or feeling generally irritable. This is quite a dangerous situation. It's very important that diabetics would check their blood glucose levels and treat to increase blood glucose levels by ingesting some fast-acting carbohydrates such as the typical jelly beans that you may be familiar with. Diabetes is obviously an annoying and debilitating condition, so it's important that we understand the risk factors so we can begin to think about how we could prevent the development of the disease. As always, there are two types of risk factors, those that can be changed and those that cannot. While we'll obviously focus on the risk factors we can do something about, it's important to know that your ethnicity, age, birth weight, and stage of life all have an impact, and we can't necessarily do anything about that. For example, Aboriginal and Torres Strait Islander people and those from the Pacific Islands and the Indian subcontinent are all at greater risk of developing diabetes simply because of their genetics. Additionally, the risk of developing diabetes increases with age, particularly from the age of 35 onwards. Risk factors which can be controlled include obesity, a poor diet, physical inactivity, hypertension, high cholesterol, and smoking. Being overweight puts you at a higher risk of developing diabetes, but the good news is that losing just 5 to 7% of your body weight can cut your risk of developing pre-diabetes in half, and your risk decreases even more as you lose more weight. Physical inactivity ranks among the top modifiable risk factors for pre-diabetes and type 2 diabetes. Achieving at least 150 minutes per week of moderate intensity aerobic physical activity, or its equivalent of 75 minutes of vigorous intensity aerobic physical activity, and combining with some muscle strengthening activities, is important for maintaining a healthy cardiovascular system. This is related to diabetes as the ability to circulate our blood around the body is very closely linked to our ability to maintain healthy blood glucose levels. Hypertension is relevant here because, in addition to causing damage to the cardiovascular system, untreated high blood pressure has been linked to the development of diabetes. You can learn more about hypertension and its prevention in my video lesson on hypertension. High cholesterol levels have also been linked to diabetes. Low, high-density lipoprotein, or good cholesterol, and or high triglyceride levels can increase the risk for type 2 diabetes and cardiovascular disease. For this reason, a low saturated fat diet, Sufficient aerobic physical activity and a healthy weight are recommended to help improve lipid levels and reduce the risk of diabetes. Finally, people with diabetes who smoke have higher blood sugar levels and less control over their blood sugar levels than non-smokers with diabetes. Smoking affects circulation by increasing heart rate and blood pressure and by making small blood vessels narrower. If you are interested in calculating your own risk of developing diabetes, you should go to www.diabetesaustralia.com.au/risk calculator. There's a series of 11 simple to answer questions which help to develop your risk depending on factors such as age, gender, ethnicity, as well as lifestyle factors such as diet and whether you smoke or not. Untreated diabetes has a number of complications. For example, you're 4 times more likely to suffer a heart attack or stroke if you have diabetes, 3 times more likely to suffer from kidney damage, and 15 times more likely to have an amputation of one of your limbs. However, the take-home message is that early diagnosis, optimal treatment, and effective management can all reduce the risk of complications. So this is where the lifestyle strategies come in. There's nothing here that should surprise you after the previous video lessons on lifestyle and diet diseases. Strategies important for type 2 diabetes are increase physical activity, particularly resistance exercise, which increases insulin sensitivity, lose weight, improve the diet with a particular focus on low fat, high fibre, and low GI foods. More about this later. Limit alcohol, stop smoking, reduce blood pressure, and monitor blood glucose levels using a blood glucose monitor to make sure that all of the strategies are having the desired effect. In the top right-hand corner is an image shown for the Diabetes Australia app, which diabetic sufferers can use to track their diet as well as their daily blood glucose levels in order to help their GP to manage their condition.